about Obamacare and what's next. Some thoughts from Karl Rove, Republican strategist and former senior advisor to President George W. Bush. He's in Austin, Texas. And Joe Trippi, veteran Democratic strategist who's worked on several presidential campaigns. Joe's in Washington. Joe, let me start with you. When I hear Democrats on the Hill, they are ready to really call this Trump care. And they are ready to kind of hand it over and say, where is the replace plan? Is that smart politics, or are they going to jump in and try to offer some suggestions?
Well, I think they, as Nancy Pelosi said, be willing to offer suggestions. I'm just not sure that the Republicans need much help from Democrats. Just the same way that Democrats passed it without a Republican vote, that's what's going to happen here. There's not going to be any Democratic support at all for repeal. Fix, yes, but I don't think any votes, very few votes, if any, for repeal. And the bigger problem is, look, they've got, this was an important step today, and it stops the any filibuster to stop repeal. But the problem still is the replace part. And Charlie Dent, the Republican member from Pennsylvania, said, let's not take off in this plane unless we know we can land it. And he said he wasn't sure they could land it. And that's going to be where the Republicans are, they're going to need to pull together and unify around whatever the replace is, and it's not clear what that is yet.
Karl, where is your sense? I mean, are there cold feet on the Republican side? Is this overblown as far as pushing replace so fast?
Well, look, the Affordable Care Act took 13 months for the Democrats to write, and even when they were voting upon it, Nancy Pelosi famously said, we've got to pass it in order to know what's in it. I think the Republicans, particularly in the House and in the Senate committees that are going to have to deal with this, are firmly committed to the idea of let's discuss this, let's work it over, let's have it be known so that when we vote on it, we know what we're going to be voting on. That means that they're not going to be able to get it done by the January 27th deadline in the for reporting a bill that's in the Reconciliation Act. That's really an important, it's a date stuck in there, but there's no enforcement authority over it. And it probably means that we're likely to get to the end of the first 100 days without this whole process being completed. But it's the right way to do it. Make sure that people understand what's going on.
And we should point out, reconciliation is 50+1, not the 60 votes needed for most things in the Senate. Donald Trump tweeting, the Unaffordable Care Act will soon be history. Take a listen to the House Speaker and the House Minority Leader.
This law is collapsing while we speak. We have to step in before things get worse. This is nothing short of a rescue mission. Our goal is a truly patient-centered system, which means more options to choose from, lower costs, and greater control over your coverage. And as we work to get there, we will make sure that there is a stable transition period so that people don't have the rug pulled out from under them.
The Republicans are feeding their ideological obsession with repealing the ACA and dismantling the health and economic security of hardworking families.
But, Joe, the Republicans control the House and Senate in some cases because a lot of those races were decided on Obamacare and high deductibles and high premiums.
No, absolutely. Look, Obamacare, because it was passed with just Democratic votes, plenty of Democrats paid the price for that over the last 6 years and aren't in Washington anymore. The problem the Republicans have is it will become Trump care. Whatever comes out of this, when they repeal, whatever they replace it with, they own. They're going to own it probably 100% with no Democratic votes either. And that's why I think Karl's right. Look, it's unlikely that this is going to happen by the 27th of January or the first 100 days. It's likelier they really should take the time and make sure that they do this in a way that when they own it, they're going to be happy with what comes out and that the American people are happy with it, or they're going to, many of them may pay the same exact price, and I think that's why they can't come to agreement right now.
And Karl, quickly, you know, there are two focuses, it seems, Russia and Obamacare, the themes that Democrats are really hitting in these confirmation hearings. Does it make it tougher for Tom Price when he gets up for HHS?
Well, Tom Price is capable of handling this issue. He's been, since he came to the Congress after the election of 2004, he's been involved in health care reform, thinking about it, writing legislation. And look, let's be clear. The Affordable Care Act, Speaker Ryan was right. It's collapsing. Remember all those state co-ops? Virtually every one of them bankrupt and gone. All those great choices we were going to have in exchanges, lots of states are now starting to find many counties in their states, or even in 7 instances, the entire state only has one option for everybody in the state. We're talking about premiums that are going up by double digits. And so the Republicans are going to take their time and do it right. Let the Democrats be responsible for what they wrote and what they passed, and that's collapsing before our eyes.
Carl, Joe, as always, thank you.